What's going on, everybody? So, let's see why this one ain't turning. I don't know. Let's see why this one isn't turning. There you go. There you go. So, this is still your evaluation and management class, okay? Um, those of you who are going to archive this, wonderful. Um, we're just going to kind of get back to where we kind of left off. Those of you who are new to my class, I changed the title to Medical Billing and Coding so it's easier for people to find me. I don't rely on the algorithm to put my videos out there. People find me. Okay. So if you have your books, take them out. Um, I'm talking. If you have your CPC guide, also take that out. Okay. Make sure that you have your step-by-step book. Now, your step-by-step book, like I said, there should be links below so you can get the sample book. That's fine. You can start off with the sample book. Even if you're not starting off with Sapphire, that's fine. That's the book that you're going to use. I know I'm trying this out. I don't know if it's gonna work or not. I keep sounding like muzzled because you guys know I don't have my long microphone. So those are the books that you're going to need. Okay, your step by step. CPC is at the end, but if you have it, good. Um, Make sure you have your CPT book. Okay, so this is more or less some of your CPT stuff. CPT, I can't even say it. CPT stuff. We did ICD 10. We are going to go back over ICD 10. When we do CPT, we do ICD 10. Those of you who are already in the Sapphire Academy, those resources are there for you to help you pass your exam. Okay, that's what this is about, to help you pass your CPC exam, to hopefully keep you on track and keep you interested in taking your exam. I'm also going to put AAPC up here because that's who you're taking your test with. Maybe you want to look at what they have on file. Maybe you want to look at some of what's going to be on the test. I'm not sure the situation with, the thing that they said about the nursing, but do I think it's a shame? I think it's ridiculous. I can't even decipher what they said as far as that. To me, give people back their money because if they pay to have a degree, then you need to give them a refund because the certificate will not be as much. That's how I feel about it. But this is just, another reason why, I tried to make this program so people are not stuck with any type of student loan or anything like that. Um, One of the reasons why I'm not sure why this one is stuck, is trying to come on. One of the reasons why I wanted to make a program that didn't need a student loan is because some of it is wasted. I mean, I'm not even sure. I've never heard of something where, the government takes away degrees and say that they are not where they. Don't get me wrong. I think it's ridiculous. I never heard of anything like that. But hopefully, um, that is something that will go away because I don't think it takes away anything from the people who actually have degrees. I mean, they still work, they still do what they need to do. Fine, okay. But again, even RNs and CNAs, you guys also can look at these courses. Make sure if you do need to have coding and you're an RN or MPA or XYZ, you guys can also look at the courses. Don't forget to go to the website. You can also join the website and get the classes from there. Remember, I have so many resources in there that will help you. Okay, let's pick this up. I don't know how to have it. Okay, so let's go ahead and get started. Okay, I just wanted to make sure that those samples was also over there. So again, if you don't have your book, that's fine. So E&M services, I'm just kind of reading from a couple of notes that I had. E&M services, okay, they describe provider services, okay? And in the E&M section, okay, we're going to go from new 99202, 99499. That's what we are going through right now, okay? Okay, and now this is, when you guys see E&M, it's evaluation and management. Okay, so I'm just going to read this little portion right here. E&M codes from 99202 through 99499 describe provider services, including evaluation patients, also evaluating patients' conditions, um, the MDM, medical decision making, that's trying to find out what's wrong with the patient. After your conclusion, the doctor has given his codes, okay? Um, the services for E&M, we all know, are going to be based on time, okay? So services are based solely on time, okay? And such as, well, we don't, I don't want to give you that, I want to get confused with that. Um, for example, a patient may visit the family physician office complaining of a sore throat. Depending on how long the provider is there, that's how severe the code is going to be. So you're going from 99212, 99213, new patient or established patient, right? And you guys know, if you are a new patient, somebody tell me what qualifies you for to be a new patient. 3 years. If you have not seen that provider in 3 years, you are a new patient. If you have not seen anybody in the group, you are a new patient. Okay? If you've been there within 3 years, you are an established patient. Okay? Even if the provider moves, if he goes to another facility, you are still an established patient with that provider. Okay? You're still an established patient with that provider. If you see someone in a specialty in that group, for urology or cardiology, you are going to be new to that provider, even though he is in the group. Okay? Because you never seen that provider before. Okay? So if you do have your CPC, make sure you read it. Make sure you read it. Because I gave you guys stuff to read from the other day, but in that reading, you were supposed to stop at office or other outpatient. But I still wanted you, to kind of move on if you can. Because we're going to head over to consultation. I want you guys to make sure you know the difference between consultation and referral. Consultation, a patient's family physician requested the patient to see a cardiologist to have a heart murmur that he identified checked out. Okay, so the provider has recommended that he see someone else for a consultation. Okay, a referral, a patient family physician refers a patient to see a cardiologist to treat. You see those two different words? So when I said consultation, I said evaluate. He sent the patient to a provider to be evaluated. Referral, he sent the patient to a physician to be treated. So there's a difference between referral and consultation. That's on 259. I don't know which year you guys have a CPC, or if you even have it. If you don't, I want you guys to still take notes on that. Okay, so you guys, I just want to throw that in because we're going to touch bases on that in this classroom. So consultation is on 259. Okay, hospital inpatient services, hospital observation, office or other outpatient. So you guys know when I start my class, I kind of go over a little bit of what we already did. All right, so if you do have your step-by-step book, it should be out by now. So we started with evaluation and management coding, okay? And we were talking about new patient, established patient. You guys already got that down, okay? Office or other outpatient, you guys already got that down. We kind of talked about that. Hospital observation services. A patient has a condition that needs to be monitored to determine the course of action. Hospital observation services. When a patient, if a patient goes to emergency room and the patient needs to be observed, the patient can be admitted for observation. Okay, now he can't be there more than 3 days without them admitting him, but he can be there for observation. So he can be admitted for observation. I'm on page 258 actually. I'm in different books, but you guys know how I do. You'll find it in there. So when a patient has a condition that needs to be mentioned, to determine which course of action the provider may have to take based on the provider's observation status. The patient is there, even if he's in ICU. He still could be in ICU for observation. He's there, the provider's coming back and forth for subsequent care maybe. But again, he can be admitted for observation status. And remember, the emergency department is ED. So if you do get an open and closed question on your CPC in regards to that, it is ED. Okay. Um, so in this case, the provider can admit the patient for observation status. After a period of the provider looking at the patient, observing the patient, checking the patient out, the patient either could be discharged or they will admit the patient. Okay? So here it also says that the patient is not required to be in a specific place. A good example of that is when you go to the provider. I don't know why that's there. When you go to a doctor's office, I guess it has to be there. When you go to a doctor's office, emergency room, sometimes you might see patients in the hallway or, like on the side. The patient is probably there for observation. Just because he's not in a side room right there, that doesn't mean that he is not being cared for or they've forgotten about him. He's there for observation. Okay, so they can see how his illness is going to act, or is the fever going to get worse, or do we need to actually admit this patient? Okay. So there's not going to be, again, there's no determination between whether this patient is going to be new or an established patient when the patient comes to the emergency room. Okay, the patient will be in observation status. Okay, the person who is going to be admitting this patient can either be the provider that he saw at the clinic and maybe he referred him to go to the ED, or the person that he saw at the hospital and they referred him to go to the doctor's office. They're still going to be the admitting doctor. Or if he did like a telemedicine services and the provider was like, listen, you need to go ahead and go to the doctor right now. He is the one who's going to be doing the admitting work. Now, this work is still going to be transferred, handed off to the provider who's going to be taking care of this person who's going to the hospital. Okay, so observation services include 3 days. Three types of services: observation care services, observation care, and subsequent care observation. Subsequent care is when the doctor's coming back on different days to see the patient. Okay, so y'all know I'm not going to go too deep all up in that, but I wanted to kind of touch bases on that here before I start looking in the step-by-step book. Okay, before I start looking at step-by-step book, because whatever you hear me say and from this book, this is a CPC book that I'm actually looking at. It's what I want you to focus on when you are studying. Those of you who are beginners, when you learn what you need to learn and you start touching bases on that, make sure you have your CPC guide. Y'all know I don't like caps. Make sure you have your CPC guide. Okay. You can get your CPC guide from Amazon, from CPC, AAPC, or you can get an old one from thrift.com. They might have one there for 2 years ago or something like that, maybe $30 or something. Okay, so again, go to aapc.com and get your book. And do not forget, you have to be a member. I want you to roll in there. You can enroll in AAPC to get those pre-tests. Now, you can also enroll in Sapphire Academy. I have pre-tests in there that will pertain to you taking your CPC. Okay, so it will pertain to you taking your CPC. Okay, so again, initial care, observation care, subsequent care. Okay, hospital observation services include 3 types of services: observation care, discharge services, observation care, and subsequent observation care. Okay, yeah, that's all of that is still a part of evaluation and management. Evaluation and management is still a part of that, because that's where you're going to get your codes from there. That's why I'm just kind of being explicit um, to this category right here before we actually move on to the step-by-step book. So I wanted to touch bases kind of on this book, because this is where you're going to get your gusto from. Okay, initial observation care. Okay, initial observation care are reported only by the physician or other qualified healthcare professional. These are the people who are admitting the patient for the observation status. Okay, so remember, initial observation status is the first observation care codes required. Okay, remember when we talking about the key codes, key components? You can go back to your CPT. Go back to your CPT, and you will see those key components up there. Okay, so in this case, for initial observation care code, in your CPT book, it's going to show you. It's going to show you the components that you need. Remember on that sheet that we were talking about, the audit sheet, it tells you the key components that you're going to need for this. Okay, it tells you the key components that you're going to need for this. If you look at the CPT guide straight thoroughly, it's going to show you how to code. It's going to convince you to understand how to code. Subsequent observation care codes. Now, they use these when the patient is seen on a date other than the date of admission services. Same thing I just told you. It's subsequent care, but the patient is being seen on a different day. Okay? Patient is being seen on a different day. Okay, I'm going to do initial over to make sure you guys are clear on that. All right? So, initial observation care codes. Okay? Are reported only by the physician or the qualified healthcare professional admitting the patient to observation status. Okay, initial observation care codes require 3 key components. Okay, 3 key components. Okay, so in hospital observation care, okay, there's 3 types of services. Okay, that I just gave you: initial observation, subsequent, and observation care discharge. Okay. And you're going to see all of that in your CPT guide. You're also going to see this. I don't know why that's up. Okay, hold on. Let me find this. You're also going to see this in your step-by-step book. Okay. Let me see. So this is where you guys should be. What's that? I knew I had OBS in here twice. I don't know why it's like that. So let me see if it fixes. Yeah. So this is where we are. All right, but we're not there. We're way down here. We're on valuation and management. I'm just going to kind of skip down and scroll down from there. All right, we just started the introduction to CPT. Okay. So this is where you should be. All right, and again, this is what we are looking at. These, again, are your objectives, okay? No, we're not going over that. We just went over the objectives the other day, okay? So we're still in evaluation and management. All right, we're talking about new patient, established patient, telemedicine, hospital consultation, okay, prolonged services. All right, we talked about 3 types, 3 factors of A&M coding. We talked about this. So, you know, this is your components. This is what you're going to code by. Okay, they're not your key components. Don't get confused with that. This is just your go-to. Okay, where's the patient? You know, what type of service was the patient seen for, and what's the patient's status? Okay, so if you got your step-by-step book, make sure you go over this so you're clear with this. So evaluation and management. Okay, one of your factors are place of service. Office, hospital, emergency department. Okay, type of service. Is it a consultation? Is it admission? Is it newborn care? Is this office visit? What's the patient status? That's the third one. Is status as in, is it a new patient? You know, this is what you're finding out. Is it established patient, outpatient? This is what you are finding out. So this will be the reason why you are looking at the medical records. It's telling you what this patient is here for. Why is this patient here? these are the things that you have to look for. So you will know the difference between that once you start looking at your CPT book. When you see 99202, you know that is a new patient. Okay, 99212, you know that is an established patient. In these cases, when you know that you're looking to find out these three factors, I'm going to get back to them, these three factors: patient status, place of service, type of service. Okay, and if you get, because this is your go-to right here, if you get lost, all you have to do is just go back to your books. Go back to your books. Okay, like I said, the hardest thing you're going to do is pass your CPC. When you're out there actually coding, you're going to know all of this already. Okay, you're going to know all of this already. And they use AI system anyway, so it's not like you're going to be coding from scratch. But we do expect you to check your codes and make sure they are right. Okay, so we just went over hospital observation services. Hospital observation services include three types of service: observation care, discharge service, observation care, and subsequent observation care. Right? And we said subsequent observation care is when the provider is looking at the patient on different days, when they're coming around checking the patient. It doesn't have to be the provider. You know, it's not always a hierarchy provider. It can be, you know, a CRNA or anyone who is checking the provider is going to be considered subsequent observation care. Okay. Now, observation care discharge services are used to report the final exam, and it doesn't have to be the person who has been seeing the patient. It can be whatever provider who has that case. They're the ones who should discharge the patient. Okay, they're the ones who can discharge the patient. Let me see this. So don't get confused with that when you guys see that. Okay. Now again, if you guys do have your step by step, take that out, because I'm gonna take it down right now. But we can go through that. So observation care discharge services. Okay. Observation care discharge services. Okay, we did subsequent care. It's right here. Okay, when I'm gonna do it again. Subsequent observation care codes are used when the patient is seen on a day other than the date of admission. That's discharge too. Okay, so if you do get a question like that on your CPC, just remember it's on any other day other than the first and the last. I would definitely highlight that. Okay, the initial observation care and observation care discharge should be reported separately only if they occur on separate dates of services. It sounds weird, but only if it occurs on separate dates of services. Okay, so if the patient comes in at 10 o'clock, and that'll be the admit date. If the patient is discharged 8 o'clock the next morning, 10 o'clock the next morning, that's the discharge date. Okay, I don't know. To me, that's like common sense, but you know, they will make sure we know that. Okay. So again, those are hospital observation services. Okay, the initial observation we already went over. I'll tell you again, initial observation care codes are reported only by the physician or qualified healthcare professional admitting the patient to observation status. But if you look at that, it's just right here to me would be second nature. When you see something like that on the test and it says initial observation care, you know that the admitting provider was the initial observation care person. Okay, he's the one who's going to be writing those notes. This one is on, but I don't know, it's looking a little funky to me. Okay, so again, and that all kind of ties all into hospital services. So you talking about hospital inpatient and hospital outpatient services. In regards to the telemedicine, we're going to get to that when we get a little further down. Okay, because when you're talking about hospital observation, inpatient, and initial observation, we want you to stick to hospital. Okay, and those of you who are going to be working in a different facility, you will be doing the providers coding. Okay, you'll be doing the providers coding. The hospital will be doing their doctors coding. Okay, so let me just get back in here. Okay, so let's kind of get down. We talked about the medical records. I'm still kind of sliding down, so that's why we just slide down. Office or Other Outpatient Coding Guidelines. Did y'all get a chance to read that? So you guys know the guidelines take precedence over anything that you see throughout the book. So as of January 2021, the American Medical Association incorporated new CPT guidelines for office or other outpatient codes. Okay, 02 to 15, and they also deleted the 99201. So that's why we don't see the 99201. The new guidelines eliminate the history and physical examination portion as key component for code selection. So this is why it's important to make sure you get books that are not too old, because this may not be in an older version. This is a 2025 book that I'm looking at, but this might not be in an older version. Hopefully that it is. Okay, the new guidelines eliminate history and physical examination. When you look at the audit sheet, you will see this on there. Remember, there's one also in there as well. I don't think this one is kicking. There's one also in there as well. Let me check it out. There's one in there. It's not as explicit as the 97 one, but I wanted you to read the AAPC one because it had a lot of stuff in it. All right, so hold on. So it does have a lot of stuff in it, but I want you to look at that AAPC one because it had descriptions in there that you're not going to see on the regular audit sheet before you even hit the audit sheet. So you guys see right here, a lot of this is in here, and it's a description in the audit sheet that has time in there. It has how long the patient was seen, 20 minutes, 30 minutes, same thing like this. It's just in a different order. And it is to help you to do the E&M coding. That's what it's for. To help you to do the E&M coding. All right, so good. As long as we got that one going, I'm not even bing-bonking about that one. Okay, so I'm just kind of sliding down because we already kind of did some of this already. Remember the 99215, 40 minutes long. Time includes performing the following activities when performed by the physician or other healthcare qualified professional. Okay, so we did this already, preparing to see the patient, ordering medication, care coordination. You guys remember we saw that. The prolonged services we're going to get up to, but I still want you to go ahead and read that as well. And these is just exercises that you can also do. If you've read enough and you think you can do these exercises, go ahead and do them. It just wants you to identify the time and what it is. That's all. And that's right here. The answers to this is literally right here. Okay. So we did this already. So y'all heard me talk about in what was it, subsequent care or observation care. They were talking about key components. So in your CPT book, you'll see what the key components are. So key component medical decision making, which is one of the key components. Okay, it's one of the key components. In your CPT book, it looks different. It doesn't look like this. So how it is in the book, yeah, it's a little bit confusing, but it doesn't look like that. So I wonder why I have two of these up. Max screen. I don't know what that is. This one is 6, right? This one that's the max screen. Okay, so we can get rid of that. This one is out of whack. Okay. For some reason, I can't get the video to stay on this one. Okay, if that one chops out, it just chops out. So, let me see. Let's block this one. Okay, good. So let me go up here and see. Because remember, I gave you what you needed for those, right? H. Oh, here they go. Well, Kindle, CPT. Okay. All right. So this one is I'm just trying to see. I want to see in here. So you guys should have the same thing that I have. Right now I'm looking in the CPT book. I have looking in the CPT 2025. I'm looking for the key components. All right, all of them together when you study your book. So that's why I said study your step by step with your CPT book. Okay, study your step by step with your CPT book. Because the way that the step by step book is set up, it could be because mine's is ebook, I don't know. But the way that it's set up, it doesn't give you like a full definition that the CPT book would give you. So I want you to look at this too, special report and also time right there. We're going over the time. This is a CPT book I'm looking at. We're going over the time as well, but I want you to look at that. I want you to read this right here. And this is just giving you more of a definition. So here, how you just do this, you're just gonna scroll down and then you see more. See, special report, right? Time. All this goes with time. And this is just telling you how evaluation management is used with time. How are you going to code it? Okay, same thing that we just went over. It's just giving you this definition in the book. That's it. So let me just show you something. You see where it says this is face-to-face time with the patient. So you're going here to here. Code symbols. All right. And you guys can get these down if you want to. What I'm looking for is, I'm trying to see if I can get you guys, the key components are in here, they're all together, but I'm just looking through it through the ebook to see if I could actually show you guys in this book. So I guess it kind of breaks down some of the information that you need. 3.2, okay. 3.2 goes through all the sections. Okay, this is what I was telling y'all about the order sheet. So this is like one of them. And wait a minute, I saw observation care in hand. You guys can also take a look at this. See where it says subsequent outpatient, inpatient. And that temporary book, you can look at that. So again, if some of you don't have your book, just take a look at those codes in here. It will give you an idea of what you're looking for. Okay, and this is good right here. Look, total duration of critical care. We ain't on critical care. But this is just giving you an example. Okay, we're not on critical care, but this does give you an example of it. That's the free book that I gave you in here. Okay, that's the free book that I gave you in here. All right, hold on. Yeah. Oh, she's so sweet. No, no, I'm trying to talk to you. I said, the ebook that I gave you, it's not gonna be a whole, like a full book. The book that I gave you from Kindle, it's really, it has a lot of pages in it, has a lot of information in it, but it's not gonna have a full, a full version in there. Yeah, it's not gonna have a full version in there, but it's gonna have the same stuff in here that I'm showing you right here. Okay, it's gonna have the same stuff. Okay, but this is stuff that you guys definitely can use. So what I'm doing is just scrolling down, see evaluation and management, um, levels of service. It probably won't let you click on any of it, but And here, office or other outpatient services, telemedicine, hospital inpatient observation care, consultations. That's why I said to read the CPT book in its entirety. But we're not all the way down here. We're literally right here, observation, consultation, emergency room, telemedicine, okay? New and established patient, solely for the purpose of distinguishing between new and established patient. This is all in your CPT book. I want you guys to see this. This is all in your CPT book. This is what we pretty much just finished talking about. Now, I came from the CPT book. Okay? I came from the CPT book with the same information. That's why I was telling you guys it's all repetitious. It is the same thing. Okay, multiple evaluation and evaluation services, observation. Okay, that ain't what I'm looking for. Okay, what I'm looking for in here. Okay, this might be it right here. Levels of E&M services. Select the appropriate level of E&M service based on the following. The level of the E&M MDM as defined. Why is it not giving you definitions of the MDM before they give you that? Okay, so yeah, it's in here. So look, you see this right here? Table 1, level of MDM medical decision making. It looks a little funky, I guess, because it's an ebook, but this is what I want you to read. You see where it says straightforward, minimal, one self-limited or minor problem. When you read the note, you're going to, let me get back in here. When you read the note, you're going to know how many problems the patient has. When you read the note, you're going to read. When you read the note, you're going to know if it's a straightforward, one self-limited or minor. Okay, you're going to know that. Okay, so that right there, we are determining what the medical decision making would be. What would the provider consider medical decision making for the patient? Will it be high? Will it be low? Remember, we did low 99212, medium 99213. Remember? Right, that's what I'm talking about. Okay, so like I said, once you continue to read it and you continue to get used to it, you will be able to understand it more. Risk of mobility, patient management, mobility. See, they even have definitions of stuff in here that's not in your step-by-step book. Okay, guidelines for selection level of service based on time. This is your CPT book. This is the CPT book that I'm looking at. So this is what you're going to also review. I'm just kind of scrolling through it so you guys can see what's in it. New patient, 99202, officer other outpatient visit for the evaluation and management of a new patient. Okay, I gotta read this piece right here. Hold on. That should have the same thing down there. Okay, so which requires a medically appropriate history and or examination and straightforward medical decision making. If you see that in the record, you are going to code this. Okay, and when you get to 99203, you can see that it's much more. It's much more. The more severe it is, the higher the code that you're going to use. Okay, and surgery is different. And surgery is a little bit different. And also in the emergency room. I mean, you're going to use, and if the patient is admitted, you're not going to use observation. You're going to use the admitting code because the observation code is not going to give them more. The admitting code will give them more. So obviously the patient is much more sicker than they thought. Okay? So, I just wanted to give you like a rundown on that, okay? So we went over the observation care, subsequent care, initial care, and we went over discharge. Don't forget, when you get to observation care, discharge services, the final exam and discharge of the patient. Typically, a patient is admitted to observation for less than 24 hours. Okay, it can't be more than 3 days. Got dry throated. Okay. So you guys look at that. How much time we got? Jeez. Okay. So telemedicine. Telemedicine services are synchronous real-time interactive encounters. Y'all know I can't even pronounce that. It's synchronous. and synchronous between a physician or other healthcare qualified professional. We did go over a little bit of telemedicine, but I still wanted y'all to do it. Okay, qualified healthcare professional, QHP, and patient utilizing either combined audio, video, or audio and telecommunication. Okay, now the levels that you're going to be selecting telemedicine from, okay, are also going to be based on the MDM. Okay, MDM, the medical decision making. Okay, medical decision making. How we saw, did the patient have this? Did he have two diseases? Did he come here for two things? How severe was it? And that's how they're going to be coding. Okay, based on how sick the patient is. Okay. So this, like I said, this is the CPT book, but I still want you guys to look at that. Okay, if you have, let me come down. If you have the CPT book, like I said, combine your studies. Combine your studies. Use your CPT book and use your step-by-step book. Okay. So we just kind of went over that. That still was something that we looked at the other day. But, as it relates to the telemedicine, I just need to make sure that you guys got that, because it's going to be the same thing looking at your straightforward, low, moderate, and high. That's the same thing with the levels, depending on how severe the patient is. How long did the provider stay on the phone with the patient? So a lot of it is going to be based on time. And we tell you that even in the CPC guide, in the CPT book, also in the step-by-step book. Like I said, when you take your test, the answer is already in the question. Let me take this down while I'm actually looking for something. The answer is already in the question. I don't know why I can't keep that one up, but I'm not studying. So let's get this back down. The answer is already in the question. Okay. In your step-by-step book, you're also going to continue going over diagnosis and complexity problems, data to review. Okay. They're just telling you what that is. Risk, okay? What are risks, okay? If the patient is not being treated, and it's just giving you information here. The basics is for you to make, I'm on 285, for you to make sure you are clear on medical decision making, complexity. How severe is the patient? A new patient's record states that an initial office visit was made for the evaluation and management of a 48-year-old male, okay, with a recurrent low back pain for a herniated disc, okay, with pain radiating to the leg. This might be too far for you. You may not be ready for this. If you are, I want you to go ahead and do the exercise 11 to 3 on page 285, or you may have a different page. Okay, remember the other day I said don't do them. And these are cases. Look, and they are E&M cases. They are E&M cases. So this is how you would do that. Look at your CPT book and look at your E&M codes. You have to read the guidelines first. You will not get this if you do not read the guidelines first. Then you will know which code that you're going to choose. So in this one, I'm going to give you a small one, not no big one. So a new patient, an 8-year-old female, okay, she came obviously to the doctor's office, okay, and don't forget these are real cases, all right. She said the child had an earache in her right ear, okay. She had an earache in her right ear, okay. The mother said that the child has been complaining. She did have pain in her ear. She said it hurts almost up to like a 7 or 8. Sometimes it's a 10. The little girl did look like she was a little bit upset. Sometimes she looked like she was crying. Sometimes she looked like she just was like scratching her ear. She almost had a little bit of a fever. Well, it was a fever, so it was over 100. You guys can read direct. I can't read directly from this. I can only give you a roundabout. Okay, so you guys know what tympanic membranes is. They were a little bit red inside her ears. Okay, so this is a question. What is the MDM level for this patient? What diagnosis code would be reported for this patient? Put the ICD-10 code and what is the MDM level for this patient. Now, are they saying what's the MDM level for this patient? They want the CPT code. You know what I'm saying? So if you use 99213, they say high, low, whatever. You could put high, low, whatever you want. The ICD-10 codes you can only do if you were at the beginning of my class, unless you already know how to do coding. I'm coming back in. So, unless you already know how to do coding, you might have a little bit of fickle with this, but I will go back to the beginning of my classes and get the coding. We're going to do ICD-10 also at the end of this. At the end of this, we're also going to do ICD-10. How long I got? Okay, I got 15 minutes. Okay, so again, it's going to be kind of tough. All right. I don't know what happened to that one. All right. But I still want you to have, I always write this up there. That's just step by step. Okay. If you do not have a step-by-step book, you see that link? Wait, I ain't put it up there. Okay, hold on, y'all. Let's get the link. Where's the link, y'all? So I'm gonna drop that link over there on the side. I'm presuming this is, the paste. All right, so that one's CPT. That's CPT link. Okay, hold on. Let me find it. I just had it open. I don't know what happened to it. All right, so if you don't have that step-by-step book, CPT. Oh, here go the link right here. This is it right here. And y'all know how I am. I like the ebooks. So I use the ebooks. But again, that's a step-by-step book right there. So don't forget about the observation codes, the telemedicine, and we talked about the telemedicine the other day. I did put this here, but we did talk about the telemedicine the other day. I'm about to get to it right now. Hospital inpatient services, emergency department reporting, consultation, clinical care. We read that tonight. Okay, we read that tonight. Stop at nursing facility services. Stop at nursing facility services. Okay. I'm talking about, look at this here all over me. I'm talking about those of you who do have this book. So what we going over in class, it might be a little bit different than what y'all are looking at right here. But if you do have your CPT book, that's what, I want you guys to also go over. Okay, so the telemedicine and so forth, we can pretty much get that from here because we just finished doing some of that. All right. No, I don't want to go to anesthesia. No, we're gonna go to anesthesia soon. That's gonna be quick. Anesthesia is easy for you guys. So yeah, again, go ahead and do this case because remember the other day this is what we were doing. Okay, but you can go ahead and try these cases if you have your book. Don't forget your ICD-10 and your CPT. All right. So we talked about the non-face-to-face, direct face-to-face. We talked about that the other day. You guys should also still go over this as well. Okay. These statements concerning are when total time is spent with a patient. This one right here. Now, you can still look at this one. Wait. I'm steady talking and you can't see what I'm talking about. You can still look at this one. If you still kind of stuck on how the E&M coding actually goes, I would just kind of revert back to this because I want you guys to go ahead and code those cases that we just looked at up here, because you've had enough to decipher what a low case is, a moderate case, a high. I'm talking about level and complexities. So some of those key components we kind of talked about already. So I'm hoping that you guys should be good to actually code with the new and established codes. Okay, the new and established codes. The observation care that we just went over, the subsequent care, the initial care, they're not going to be on this one. This one, I just want to see if you can code uh, new patient and established patient. Okay, so that's the only thing I want to see if you guys can get comfortable with. And again, this is giving you a description of the components that you're looking for the case that you need to code. So if you get ready to go code one of those cases and you see this down here, time is 15 minutes, that's your level. Go see what level is for 15 minutes. Then you will know which code this is. Okay? We did this. We did that the other day. We did the new patient the other day. Okay, so you can now do this. Go to exercises 11 to 5. Go ahead and do those. All right, so this is the telemedicine portion right here. All right, so the telemedicine, the codes in telemedicine subsection 98000 So we did go over it. I just want to make sure that you guys are good with it. Um, your doctor may not even do telemedicine, but this is for test purposes and if you actually have to code something on the teleservices. Okay, so are assigned to report real-time encounters with a patient and physician or qualified healthcare professional, are interacting live through a synchronous medium such as audio XYZ. We did this the other day, but I still want you guys to go over it. um I'm pretty sure you can't see this. I don't know if you can or you can't, but just make sure you get the book so you can kind of go over this. The link that I put on the side, you can actually download that so you can get the book. Okay, so make sure that you download that if you do not have the book. Okay, so let me go back in here. So combined audio video services are reported with 98007. Okay, while audio only services are reported with 98008, 9805, prolonged services are 99417. We haven't gotten up to prolonged services yet, so just continue reading, and then when we get up to that, we will start talking about that. Okay, so your prolonged services and your CPC guide, if you have it, it's only a small section, but we're not going to get up to that one yet. Because hospital services, observation services is right here, as we already pretty much did the observation services. But again, this is your step-by-step that you're going to be looking at. Okay, so here, the telemedicine. Look how quick it is. Okay, so again, that's why I want you to just make sure you review it, especially for test purposes. What time is it? Okay, hold on. All right, so as of January 23, the codes for hospital observation are 9221, 9223 for initial observation. So you can see the codes change a little bit. That's why they want you to have new books. Observation is a status used for the classification of a patient who does not have an illness severe enough to meet acute inpatient criteria and does not require resources as intensive as an inpatient, but does require hospitalization for a short period of time. That's observation. Okay? Observation, 24 to 3 hours. Patients are also admitted to observation so further information can be obtained about the severity of the condition, which we just talked about. Okay, but you could see the different type of verbiage that's in the step-by-step book versus what's in the CPC book. CPC is being direct. When you take your test, this is what we're looking for. Okay, the step-by-step is teaching you, is giving you more word for word. Okay, so no, I'm not going to read the whole thing. So you're going to read that observation codes 99221 and 99231 reported inpatient outpatient. Yeah, you're gonna look at that. Okay, I want you. That's your answer. You're going to go through that observation care discharge. We went through that already. We went through this already, but I want this here is different. The observation care discharge services. Remember, we just read that in the CPC guide, but now we're looking at the step-by-step book. Include the final examination. Remember, the final examination of the patient upon discharge from observation status. Discharge from observation status. So the patient is not going to be admitted. They're going to send the patient home if he's going to be discharged. Okay. If he's going from observation status to admitting, you're not going to use the observation code. Discussion of the hospital stay, instructions for continued care, and preparation of the discharge records are also bundled into observation care. Bundled. The word bundled means you're not going to use 4 or 5 codes. You're going to use probably one. Okay, we ain't get to that yet, but I'm giving you a word to the from the wise. Into observation care, discharge service codes. Okay, these codes are used only with patients who are discharged on a day that follows the first day of observation. Okay, so this just gives you more of what we did. Okay, you don't have to read it the way I'm reading it. I want you to read it word for word. When you read, I want you to do kind of highlights. I know I'll be messing with my eyebrows. Okay, so we got 3 minutes, but I still want you to take heed to that. Tell me my eyebrows messed up like that. I ain't fooling with you no more. They don't talk on here, but y'all talk all the time on here. But Tamara and them went out. All right, Tamara, y'all went out. I don't know what happened to this device, but y'all gonna have to archive. All right, so I'm just kind of going down because we're getting ready to come out. Okay, subsequent care we did. I do want you to do these. Look, I want you to do these exercises. So this is for tonight. Do these exercises. Okay, hospital observation services. Okay. Hospital inpatient or observation care. So the inpatient part is a little bit separate on this, but it's enough for us to go ahead and do in a different segment. I'm going to do the inpatient services with the consultation. Okay, so hospital inpatient or observation services. All right, it's just giving you the codes. I also want you to look at these codes, and in your CPT book I want you to separate codes that look alike. So use your highlighter to differentiate those codes. Okay, hospital care and observation care, or subsequent except hospital discharge or observation care, are divided based on medical decision making. What's MDM, y'all? Medical decision making. Okay, the subsection of hospital inpatient observation care services is included in 2 subheadings. Okay, so yeah, this is important right here, because on your CPC they going to ask you what are the headings, what are the subheadings, or what is the subheading of this section. So you have to make sure that you know the difference between the subheading, okay, and the we ain't get to that part yet, but I'm just kind of throwing that out there real quick. It's going to have I might have a question on there for that. So don't forget to go to, I'm putting it in here. Don't forget to go to AAPC.com and look at what they have there. Look at what's on that test. Look where it says, go to the store, and scroll down. It'll show you all their books. Get to CPC guide. When you get there, they're going to show you what's actually on the test. I have a chat that says that. You don't even have to go there if you don't want to. So there's a chat on my YouTube that actually says that. Okay, so I'm just kind of scrolling down. I'm gonna take this down. I'm on 296, so I want you guys to do tonight. Just go back over hospital inpatient observation care. The subsection of hospital inpatient or observation care services is divided into 2 subheadings. Subheadings as an initial hospital, inpatient, or observation. Okay. Subsequent hospital inpatient or observation care. Okay, some of it is common sense, but I'll read it anyway. Okay, initial hospital inpatient observation care codes are used to report the initial services of admission to the hospital by the admitting physician. Now, this is the same thing that I just read to you in the CPC. That's why I said it's going to be repetitious. But this is, the CPC guide is more towards your advanced classes, but I'm just throwing it in there already. The step-by-step guide is what is going to give you, we still going to go back over this. The step-by-step guide is what's going to give you your introduction to coding, period. Once you get your introduction and you get used to these words, you get used to some of these things that we're talking about. When you hit the CPC book as a whole, you will understand it, because you see how I did the CPC book. The CPC book, it's not gonna baby you like the step by step. The CPC book, I can't even say it. The CPC book is gonna be direct. They're gonna be direct. They ain't about to be beating around the bush and start reading stuff to you like how the step by step book is. That's why it's called the step by step book. It teaches you step by step. The CPC guide does not. You're either gonna get it or you don't. You see what I'm saying? That's why we use the step by step book. Okay, that's why we use the step by step book. Let me just get back in here. So, hospital observation services, hospital inpatient services. We ain't gotta do consultation. We're gonna do that at another time. All right. So what we got in here is where I'm gonna stop at. What we're gonna do in here. Let me just see. What else they have down here? That's it. That can't be it. Subsequent hospital inpatient or observation care. So we already an hour in. So tomorrow, I don't know. Y'all let me know. Y'all want me to take a 15 and then we come back with this? No, because every time I do that, then y'all start dropping off. Y'all start dropping off. All right. So we can make subsequent care, observation, care, inpatient a second chat. I'm just kind of looking in here. 11.7, don't do 11.7. Don't do 11.7 until you do hospital inpatient observation care and initial hospital care, which we just went over. But because this is much more in depth, I want you to also read this portion, okay? Because this is where we're at, okay? Only the admitting physician can report the initial hospital inpatient care. Because remember, what you learn in the step-by-step book is going to be repetitious to what you get in the CPC book. Everything is going to be repetitious. Everything in the medical terminology book is choreographed just like what's in your CPT book. So you see how I'm showing you how you're going to study for your test, okay? Don't move on to 11.7. I'm just kind of subsequent hospital inpatient care. I'm kind of moving down to see what's in here. The patient's medical record should indicate the patient's progress. We know that's in there already. So right here, I'm going to show you this right here. And subsequent care is just kind of giving you more in depth. Okay, that's what you're going to be looking at for your homework. I'm not going to sit here and read this whole thing to you. I don't want to do that. What we do is to put you in the right place and kind of let you know what you're going to need on your test. So when you get to the attending physician, I want you to write that down. Write down attending physician on the index card. Concurrent care. I'm going to tell you what the concurrent care is being provided when more than one physician provides service to a patient on the same day for different conditions. Okay, an example of concurrent care is circumstances, okay, in which physician A, a cardiologist, treats the patient for a heart condition, and at the same time, physician B is treating the patient for cancer condition. Okay, write that down. Do not sleep on this. So when we come tomorrow, we'll know. I had to delay this class for a minute, but tomorrow morning we should be on track for 10 o'clock. After I ain't make the thumbnail yet, but I'm going to make it. An attending physician is a doctor who, on the basis of education, training, experiences, is granted medical staff membership and clinical privileges by a health care organization. I'm going to put this up just so you can see this one, because I want you to also study this. So concurrent care, we're going to go over, right? That's your homework tonight. Attending physician. Remember, the step-by-step book is a training book, okay? The step-by-step is a training book. Make sure you have it, okay? I know I'm 5 minutes off, but I just wanted to get this real quick. Okay, we're going to shut that down. All right, let me take a look again. So tomorrow we're still going to go over the observation services, because I think you need a little bit more on that before you start doing the coding on that. But what I do want you to do is to look at the codes, 99221 through 99239. Just look at them. Okay, look at them, read them. Okay, in your step-by-step book, you're going to do, I still want you to read this: observation care, discharge services, initial observation care. Okay, this is homework. This is what you're supposed to be doing. I'm gonna put it up so you can see it. This is what you're supposed to be doing. Okay, observation care, discharge services, initial observation care. Finish reading this. Okay, that's what you're supposed to read. Okay, I don't know. I'll figure out a way how, what you're supposed to be reading. But if you guys are in class, you know what you're supposed to be reading. Okay, observation, inpatient care, subsequent observation. Read that. Try this if you want to. This hospital inpatient observation. Okay, initial inpatient, and try these. Okay, then we're gonna come back at you. Okay, you already know to do this subsequent. Okay, because I gave you concurrent care and attending physician. Okay, I'm just trying to see if that's it. So that's where you're gonna stop at, right here where it says consultant care. So observation, um, stop at consultation. Stop at consultation. All right. So tomorrow is consultation. We're going back subsequent care. Okay, I can't even say it. We're going back over this tomorrow. What you guys see up there. I'm just gonna have a different thumbnail. I might not. I don't know. Have a different thumbnail. I'll probably just change the color of this. All right. So we're done. I'll see you tomorrow. I think I'm gonna do it at 10 o'clock. You guys go ahead and archive. I didn't see a lot of y'all in the class today, and I think it's because I changed the class for a while. I'm gonna try to do this at 9 o'clock in the morning. I like 9 o'clock in the morning with y'all. We're gonna try 9 o'clock in the morning, but all subsequent care, observation care, initial observation. I'm gonna make a thumbnail